Good morning and welcome to News Views. I'm Judy Sue. As you might have heard, we are now entering the critical time during the COVID-19 pandemic here in Chicago, where health officials are expecting a potential surge of cases. But at the same time, hospitals still have to treat other patients who will be coming to emergency rooms. To get a sense of what the hospitals here are doing right now, we're talking this morning with Dr. Dino Romaro, professor and chairman in the Department of Emergency Medicine at Rush University Medical Center. Dr. Romaro, I know it's busy and in a critical time right now. Thank you so much for taking some time to join us this morning.
Thank you, Judy. Good morning.
I do want to start with a number that Mayor Lori Lightfoot mentioned this week, 40,000 as the number of potential hospitalizations that could be happening in the city of Chicago in the coming weeks. That is a tremendous number. If we come anywhere near that, how would that impact our system here?
Yeah, that's a good question. That is an extremely large number of admissions that could come into our hospitals. We have to set up multiple areas of treatment within all of our hospitals to be able to handle that surplus of patients. What we're finding is that as patients are trying to recover from the illness, a number of them are getting sicker. And when they come to the hospital, that's when they require admission. And the health system is set up like a series of dominoes, if you will. So big hospitals like Rush, we have set up multiple places to treat patients that we normally wouldn't put critically sick patients, but we will use those rooms as we need to. Other smaller hospitals don't have that capacity. So as they run out of capacity, those patients will be sent to the larger hospitals. And in turn, the larger hospitals will start to run out of capacity. So we're doing everything we can to make the most of all the space that we have available to us.
And so, Doctor, take us through a little bit of the steps that you are taking at Rush. We know that you have basically transformed the lobby area. Is that right?
That's correct. We transformed the lobby area of our main entrance on the ground level into a low acuity treatment area. And that's to take patients who don't have this illness but have other conditions, and we want to keep them separated from patients who may have COVID-19. So we're using that area. We're also using the ambulance bay for patients who have potential COVID-19. And then we're using a number of, we're using our ICU beds as well as some alternate care ICU beds that we might have to pull into action.
So, Dr. Romaro, we are now about 2 months, I think, into the first case of COVID-19 being confirmed here in Chicago. Can you take us through a little bit about the growth pattern? I know that you and your team watched that very carefully from the very beginning, and explain to everybody why this is sort of this critical period that we're going into.
Yeah, so we've been watching this. You're absolutely right. We've been watching this from the very beginning. And I remember when we were looking at it, there were 20 cases in Washington and 2 deaths at the time. So obviously it's spread. We're hearing reports as of yesterday. We're starting to see spread in the southern part of the United States as well. We're at a critical juncture right now as we monitor the numbers, and there's a lot of different models out there. We had a slight glimmer of hope a few days ago that some of the numbers seem to be tailing off a little bit. Now, mind you, we are only 5 days into the social distancing initiative that was started in Illinois. So we might be seeing the early stages of that positively impacting the course of this disease process. Having said that, we are by no means out of the woods. We have to continue the social distancing. We have to continue to monitor the patients coming into our hospitals. The low acuity cases we have to keep an eye on, as well as the high acuity cases.
We'll be back with more of our discussion after a short break.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.